Hello everyone, my name is Frances Roderick and I'm a physiotherapist at Archstone Physiotherapy in Rothesay. And I was contacted by KB3C to be a part of their speaker series, and I was quite honored because I've listened to some of the other speakers and their talks, and it's really great to see some really amazing information being put out to the women in the Kennebecasis Valley and the St. John region. So hopefully I can add to that today. My area that I practice in is a little bit different than some regular physiotherapists in that I focus my practice around pelvic floor physiotherapy. And so that means that I tend to focus my work on problems that are happening in the pelvic floor muscles, in the hip, in the pelvic girdle, in the deep abdominal muscles, as well as the diaphragm. And so as such, you can appreciate that I would see a lot of women through pregnancy and following childbirth. As a physiotherapist, I'm always amazed at how incredibly adaptable and resilient our bodies are. And at no time do you see that more than during pregnancy and childbirth. Our bodies go through some tremendous changes in a relatively short period of time. And because of that, I think with so many changes happening, it can be difficult for women sometimes to know, is what's happening to me normal? Or is this something that I should be paying a little bit more attention to? And with some of these changes, again, it changes the way we normally perform some of our activities. And as we try to get back to that normal lifestyle, whatever that means, we can sometimes run into some troubles. And so here in the clinic, I hear lots of questions from women when they're coming in, either during pregnancy or as they're recovering from pregnancy, or even years down the road. What's happening to my body? And so what I thought we would do today is maybe just go through some different questions that I hear, some of the more common questions that I hear, and we'll kind of dig into that a little bit more and hopefully give you some answers about what you can expect. So the first question I thought we would talk about today is, what exactly is the pelvic floor, and what are some of its jobs, and how might we know if it's not working well? So just to kind of make sure that we're all on the same page and kind of have an understanding of what we're talking about when we talk about the pelvic floor, I brought some models along with me today, and this is the basic bones of the pelvis, and this probably looks familiar to a lot of you. You've got the spine and the back and the sacrum. So where the sacrum attaches onto the big pelvic bones here, this is the SI joint. So that's a term that's familiar to a lot of women. They might hear that they have been told that they have SI pain, and they're not entirely sure what that means. But basically that's referring to this joint in the back where the big pelvic bones attach onto the sacrum that comes down to the tailbone in the bottom there. Okay, and then this is the pelvic outlet, it's called, and this basically is where the baby's head would have been sitting during pregnancy, and then that baby's head moved down through there, and if you had a vaginal birth, out the vaginal canal, or if you had a C-section, then you may have had a scar right along here where the baby has come out through the belly. And sitting in the basin of this pelvis are all the pelvic floor muscles. So if you want to get a sense, I'm not sure if you can appreciate this on the screen, but you can get a sense of all those muscles that sit. And I say almost a little bit like a trampoline in the bottom of the pelvis. And they have a number of jobs. We think of the pelvic floor muscles sometimes as just a little tiny strip of muscles, but they're actually quite big, and they actually do a lot of work. So again, if you think back to my model there and you think of them sitting in there, one of their biggest jobs, obviously, is to squeeze off the tubes for the bladder and the rectum so that things stay in until it's socially acceptable for them to come out. So if those muscles aren't working well, sometimes that's when women will say experience a little bit of bladder leakage, or they might have some urgency or some frequency with their bladder, or if they're not working well around the rectum, they might have a hard time holding back gas. or sometimes women will even have some incontinence or some leakage of stool, and that can be frustrating for women. If those muscles also surround the vagina and hold up the uterus, and so again, if they are not working well, or if they're feeling a little bit sore or tender still, you might find that intercourse becomes a bit painful. And so we're going to talk about each of those topics in a little bit more detail as we go along. The other thing that those muscles do is that they actually work really closely together with the rest of the muscles in the pelvis and the hip girdle and in the core or the deep abdominal muscles, as well as even the diaphragm muscle that helps with breathing. So I like this model, and again, I'm not sure how much you can appreciate it on the screen, but I do use this sometimes in the clinic with women to just give people an appreciation of how closely those things work together. So if you wanted to imagine that these were your legs coming down, and this kind of center part is the pelvis with the pelvic floor muscles kind of down here, and then these are the muscles of your core up here. I just like the way that this kind of demonstrates how, as we're moving, all those pieces move together. The medical term for that would be tensegrity, but it's just amazing to me how much all of that whole system interacts and works well together, and how one of the big jobs of the pelvis is just to kind of transfer force from one side of the body to the other. So as you're moving your legs, or as you're squatting, or bending, or reaching, or lifting, all of these parts needs to work together. So again, sometimes one of the things that is, if these pelvic floor muscles aren't working well, women might be coming to me and saying, I've got hip pain on the outside of my hips, or maybe that SI joint in the back is causing me some trouble, or maybe I've got some low back pain, or the muscles in the front. I've been told that the muscles in the front are separated, and I'm worried about that. So we're going to talk about those a little bit more detail as we go along as well. So let's talk about the bladder and the bowel. One of the common things that women find after childbirth is that their bladder control is not what it was. And I think some of the messaging that women hear is that that's kind of normal. Be thankful that you've got a nice baby, and sorry for your luck. And if you don't hear anything else from my presentation today, one of the things I want you to hear is that leaking in the bladder is not something that's normal, and it's not something that you have to put up with. So if that's something that you're struggling with, don't accept that as just, well, I guess it's part of having a baby. It's a sign that your pelvic floor muscles and all the other structures in the pelvis are not working together well, and there's often things that we can do to help with that. One of the things that you might be noticing is that your bowels are a little bit sluggish, or that you're having a hard time holding back gas. So one of the simplest things that you can do to kind of take some of the strain off of the pelvic floor muscles is just to use a stool under your feet when you're sitting on the toilet. You may have seen the infomercial about the squatty potty, and if you haven't seen it, I would encourage you to just go Google that. There's a neat little infomercial about a really funny little unicorn who will tell you way more about your bowel than you ever wanted to know. And I often say to women, you don't need to buy a special squatty potty. Often just a little Rubbermaid stool. It's about 7 or 8 inches underneath of your feet when you're sitting on the toilet can take a lot of strain off the pelvic floor muscles following childbirth, especially, and until your bowel kind of gets back to feeling a little bit more normal again. The other thing that you want to be careful of is just sometimes, again, following childbirth with just a lot of the hormonal changes, and again, just because that baby's been taking up space, and maybe even if you've had a C-section, that bowel may be feeling just a little bit sluggish. Sometimes I say it just feels a little bit discombobulated. It used to live here, and now it lives here, and now it used to have lots of support and now it doesn't, and it's just kind of trying to figure out its new normal. And so for a lot of women, it's not uncommon following pregnancy to feel a bit constipated. So from a physiotherapy point of view, one of the things that you can do is some nice abdominal massage, and again, just nice, gentle, nice circular motions just around the tummy. And there's lots of different techniques and styles that you can use for that. But really, it doesn't have to be anything special, just some nice, gentle abdominal massage. Sometimes, again, if you're just lying in bed, as if you're feeding the baby and just taking a little bit of a rest afterwards, lying down, just doing a little bit of gentle tummy massage can be helpful to get the bowel stimulated to moving again. The other nice thing is just doing lots of nice deep breathing as the diaphragm moves up and down. Again, it's a really nice way to kind of stimulate the bowel and get that feeling back to normal again. So sometimes I'm a little bit careful. I don't like to use the word deep breathing with people because then I find they just do lots of and what I really mean by that is just taking your hands and putting them on your lower rib cage and just doing a nice breath and just feeling your side body rib cage expand under your hands. This can get a bit stiff on women after pregnancy because, again, that baby's just been sitting up in the rib cage and you haven't really been taking really nice deep breaths or really getting your diaphragm moving a little bit. So that can be a nice thing to do. Again, if you're just sitting feeding the baby, or if you're standing in the kitchen waiting for the toast to pop or waiting for the kettle to boil, just doing some nice, gentle, filling breaths into the lower rib cage. And that can help with some of that bowel constipation. The other thing is to just really be careful about straining. The pelvic floor has been through a lot following pregnancy, and it's still feeling a little bit sensitive, maybe a little bit vulnerable. And when we're really straining to try to pass stool, it's putting a lot of pressure on those structures that are still just feeling a little sensitive. So being very careful about straining and using a little bit of a sometimes the technique that I'll get people to do is to blow out against a closed fist. So instead of doing I call it the purple push, where you're like pushing down, just breath in and a little bit of a breathing out and just feeling your tummy expand and getting a little bit of pressure if you're having a hard time getting that stool to move. Or the other thing that you can do is just support the perineum or that bottom a little bit. If you're feeling like you're having to strain to push your stool out, and if you're really struggling to not to talk to your pharmacist or your family physician about the possibility of using some stool softeners or some other things to again just help to keep that stool nice and soft until your bowel feels back to normal again. So that's kind of bowel. In the front, we have the bladder. And again, one of the pelvic floor's jobs is to really hold the bladder up and support the bladder, as well as it kind of has a role in helping us to know when our bladder is full and when it's time to go to the toilet, as well as it squeezes the urethra or the tube from the bladder shut so that it keeps the pee in until it's time for the pee to come out. So if you're struggling with leaking when you're coughing or sneezing, a little bit following pregnancy, kind of those first few weeks, that's a little bit normal. If you're still leaking at kind of 10 to 12 weeks, especially postpartum, again, that's saying that your pelvic floor is struggling a little bit to get back to normal again. And sometimes seeking some help out for that can be helpful. You can try doing some Kegels. If you're finding it hard to know if you're doing those right, it might be helpful to talk to a pelvic floor physiotherapist about that. The other thing that people struggle with sometimes with the bladder is something called urgency, and so that's a little bit different. And urgency is when you have that really strong, sudden feeling, that sensation that you need to go pee now, and there's just no putting that off. And you're doing a little bit of what I call the panic pees, where you're feeling that bladder filling up and you just have to go right now. And you might even be getting a little bit of the term that we use is urge incontinence. So as you're doing that mad dash to the bathroom, you're actually starting to leak a little bit on the way there, not quite able to make it there. And so again, that can be a sign that the bladder is still feeling a little bit sensitive. Normally, as the walls of the bladder expand, they just slowly expand, and you get that signal up to the brain saying that, oh hey, next time it's socially acceptable, maybe you could go pee, and you can say, thanks for letting me know. I'm just going to finish doing this email, or I'm going to finish making this meal, or I'm going to finish feeding the baby, and then I'll head off to the toilet. But if the bladder is feeling a little bit what I call sensitive or twitchy, as it starts to fill up, it really starts to get those muscles in the bladder wall start to contract and saying, you've got to go right now. So part of that sometimes is just retraining that bladder and giving it a little bit of grace to kind of start to become a little bit more recognize what full is again. And so that can be some different strategies. And if that's something that you're struggling with, then I would really encourage you to talk to your doctor or maybe go in and see a pelvic floor physiotherapist. And it's often some simple little techniques that you can use to get that back on track relatively quickly. So those are some of the common problems that I see with people following childbirth and pregnancy with regards to their bowel and their bladder. Okay, so we've talked about the bowel, which sits in the back of the pelvis, and the bladder, which sits more towards the front. And then in between those is the uterus and the canal that comes down from the uterus, which is the vagina. And if the muscles around that surround the vagina or in the perineum are still feeling a bit tender or sensitive, what women will often relate to me is that sex has become painful. And obviously this is often quite concerning and distressing for women when this happens. And I find there's a couple reasons that can contribute to that pain. And one of my biggest messages, again, is that if you're struggling with this, seek help for this. There's things that you can do. Because often I find the message that women have been given is that this is normal, it's just something that they have to put up with, that it will get better with time. But what we know is that if you're still struggling with painful intercourse at 12 weeks, the chances that this will be persisting at 12 months is about 75% to 80%. So it doesn't go away by just ignoring it. Often the pain is coming from the scar. So if you've had a vaginal delivery and you had some tearing and maybe you've had some stitches, sometimes when that scar heals, it'll still feel a bit sensitive. And one of the simplest things that you can start to do is just doing a little bit of scar massage. So if you think of the vaginal opening like a clock, with 12 o'clock being closer to the pubic bone and 6 o'clock being closer to the anus, just going down in the vaginal opening. Let's see if I can make this. Here we go, just like this. So just going around the bottom of the vaginal opening and just pressing and see if you feel some tender areas. Okay, and you might find a spot there you go like, oh, that's my pain, that's that familiar pain that I feel with intercourse. And this gently just starting to do some little circle massages. Okay, you don't need to tug and pull on this, but just gently starting to do some gentle massage. And then you might find you can feel that scar, and just gently going along the scar on either side of the scar and just doing some gentle circle massages, just moving the tissues around. I see sometimes that scar just doesn't know what normal feels like anymore. It's feeling a little bit guarded. It feels like it wants to protect that area a little bit. And so just putting a little bit of normal input into that area again can be really helpful. So this is a nice thing to do. I often say to women to do it while you're in the shower, or when you just get out of the shower, and just to put one leg up on the side of the tub or on the flush, and just gently start to move those tissues around a little bit. And just start to explore that area a little bit, find out where some of the sensitive areas are, and just see if you can start to just get them used to being moved again, and moved around and tugged and pulled on a little bit. And then if that doesn't help, then again, seeking out help from a pelvic floor physiotherapist. Often we can give you a little bit more specific direction on how to do that, and we'd be happy to help you with that. The other thing is that, again, sometimes, and if you imagine that vaginal canal going up towards the uterus and is just surrounded by the pelvic floor muscles, and as that baby's head comes down, sometimes those muscles inside have been stretched and tugged and pulled on, and sometimes they're just still feeling a little bit sore, feeling a little bit like they want to guard and protect you a little bit. I say, just like if you've had a sore shoulder, what do? You kind of tend to hold that up nice and tight. So sometimes after those muscles have been stretched during pregnancy, especially if you've had a long pushing phase, or maybe you've needed to use a vacuum, or maybe you've had to use forceps, those muscles have had maybe a little bit more stretch on them than they would like. And they're having trouble getting back to normal again. So if you're finding that the pain is a little bit deeper, again, just starting to practice, see if you can feel, as you feel a little bit of a gentle tighten of those muscles, can you relax those muscles down and just get a sense of how much tension you're holding in those muscles. So I often will just say to people, as you're going about your day-to-day world, maybe you're sitting feeding the baby, or maybe you're sitting at a stoplight, or maybe you're watching some Netflix at night, just check in with your pelvic floor and just get a sense of how much tension are you holding in your lower abdominal area, or in your butt cheeks, or in the pelvic floor. And just see if you do a nice gentle breath in, that just nice filling breath into the lower rib cage, can you just let those muscles relax down and just get a sense of, are you holding a lot of tension in those muscles? And then if you feel like you are, again, just through the day, just do these nice little check-ins with your pelvic floor. Just a gentle breath in, filling breath to the lower rib cage, and then breathe out and let those muscles relax down. And just every now and then through the day, give them a nice little, I say, invoke the relaxation response. Just let those muscles relax down a little bit and see if that helps. And again, if you find that that's not helping, reach out, because there's often lots of things that we can do about it, and it's not likely to get better in any sort of timely fashion by just ignoring it. Probably the third most asked question that I get in the clinic is, when can I go back to exercise? When is it safe to get back to my normal exercise? And the answer that I'm going to give you is the most unhelpful: it depends. It's a really hard question to answer, I find sometimes, because everybody's experience with pregnancy and everybody's experience with delivery is very unique to them. So whether you've had a pregnancy that was complicated by a lot of back pain, or maybe a lot of pelvic pain through your pregnancy, your recovery might look different than somebody who didn't have, kind of one of those people who just sailed through pregnancy, that pregnancy glow that we're all so jealous of. Or maybe you had a really prolonged delivery with a long pushing phase, or maybe needed a vacuum, or maybe even needed some forceps. Your recovery is going to look really different from somebody who didn't have that experience. Or maybe you had a surgical birth where you delivered through your tummy muscles through a C-section. Again, your recovery is going to look very different from somebody who had a vaginal delivery. And you might have different considerations. So there's no hard and fast guidelines. And so sometimes the analogy that I give to people is that I can have 3 people leave the clinic here, and all 3 of them go out and they step off the curve and they sprain their ankle. And one of them might have a very mild sprain. They limp for a few days, put some ice on it, wrap it up a little bit, and then they're back to playing soccer next week, and hardly knew anything happened. You might have a second person who goes out and they step off the curb and they really kind of tweak those ligaments in their ankles and give them quite a stretch, and maybe there's quite a bit of bruising and some swelling, and they might limp for several weeks. And they need a little bit more time before they get back to their normal activities. And then the third person might go out and they step off the curb and they end up in a cast with their ankle. So three people going through similar experiences are going to have three completely different experiences with healing, and childbirth is kind of the same. If you think of what happens when you're going through, and in this instance, maybe we're talking a little bit more about a vaginal delivery, but as that baby's head comes down through the vaginal canal, the muscles that surround that canal, they really need to stretch out. And again, like I said in the beginning, those muscles are amazingly strong and resilient and adaptable. The pelvic floor muscles can stretch way further than any other muscle in the body. And yet for some people, it's going to take them a little bit longer to kind of snap back again than others. One of the things that one of the exercises or forms of exercises that probably people ask me the most questions about are getting back to my core and more the high impact exercises. I think when we're talking about simpler, maybe that's not a good word, less strenuous exercises like going for a walk or doing some gentle yoga or things like that. I think if I give people the advice that, just listen to your body, see how you feel, that people can kind of relate to that advice. So if they're walking and they're feeling a bit tired, then, or if they're feeling some pain, that's easier for them to figure out, am I ready to do that or not? I think when you want to get back to kind of more higher impact activities like going for longer runs or getting back to kind of more HIIT style activities where you're doing a lot more skipping, maybe some jumping jacks, some higher impact activities, we need to be a little bit more cognizant of the stresses that we're putting on those healing tissues. We did have a really nice guidelines that came out in 2018 that started to give us a little bit more helpful objective information around knowing when to get back to running postpartum. But even within those guidelines, I think there's a lot of room for flexibility in that different women are going to have very different experiences depending on the type of birth that you have, depending on your natural genetics, depending on your age, depending on how many previous births you've had, all those sorts of things. But the general guidelines that I give to women is that most women have not healed enough at 6 weeks to go back to doing full impact activities. It takes a bit longer, especially if you've had a C-section or if you've had a more challenging birth, for those tissues to get their natural integrity back again. Some of the things that you can pay attention to know if you're ready to go back to running or higher impact activities again is your bladder will let you know quite quickly. So if you're having any leaking when you're starting back with your exercises, that kind of is a little bit of a yellow flag to me, kind of waving to say, you know what, those tissues aren't quite strong enough to handle that activity yet. And if that's the case, I would just kind of hold off on that a little bit more and maybe going back to some more lower activities like walking or some restorative style yoga. Okay. The other thing that, the other kind of, I would say leaking is my yellow flag maybe. My red flag is if you go back to running and you're feeling what I call the ba-boom sensation, where you're running and you're kind of feeling this like heaviness in the perineum or in the vaginal area, or especially if you feel any sort of bulging in that area. That's my red flag to say, you probably need to be assessed by someone, and those are things that you might want to get in and discuss with your doctor, or make an appointment to see a pelvic floor physiotherapist. The other big thing that I would say is that if you're having any pain when you're running, that and whether that's hip pain or back pain or knee pain, again, your bodies have been through a lot, and it takes a little bit of time to get those tissues back to healing again. So just being a little bit respectful of the pain. I say respect the pain, but don't fear the pain. So if you're having some pain when you're running or getting back to exercise, that's a sign that you maybe haven't quite earned the right to do that activity yet, and maybe need a little bit more time before going back to that activity. And so if time is passing, and if you're getting to, again, if you keep trying and you're continuing to have those symptoms, then again, I would talk to somebody about that and get some more specific advice on that, as we're working to get that pelvic floor and those hip and core muscles back to working a little bit more back to the way they used to be. So we've touched today on a few of the common concerns that women coming into the clinic express to me. In summary, I think the key messages that I would hope that you take home from the talk today is that our bodies are amazingly resilient and adaptable, and they go through some pretty significant changes in pregnancy in a relatively short period of time. And most of the time, we can kind of go back to living our life as we did prior to having children. But everybody's experience and journey is different. Everybody's birth story is different. And that while our bodies are, again, adapting to some of those changes following pregnancy, it can take a bit of time, and sometimes a little bit more TLC. And that I would just encourage you to give your body some time to adapt and recognize that they've been through a lot. And if you're having trouble, that please don't accept it as normal. And that always our goal following childbirth is to get you back to living the life that you want to live, doing the things that you want to do without putting restrictions on your body because the muscles in the pelvic floor are not working the way that they should. So if you're having trouble with leaking, if you're finding that sex is painful, if you're struggling to get back to your normal activity levels, seek out some help. Try some simple things first. Hopefully I've given you a couple little tips. Often it is just a few simple things that you can change. And if that's not the case, then please seek out some help. Because there's no reason to continue to limit yourself. So thanks for listening today, and hopefully you found some helpful tips.